I had a friend from high school call me this week, and we had a meeting. She was asking about what type of fall prevention measures has Balance University or Emeritus Health addressed, or what we've come across, or what do I know of in terms of acute care fall prevention. So what is acute care? Okay, acute care is, knee replacement, hip replacement, you go in maybe pneumonia, something like that. It's you're not going to be in the hospital for a long period of time, right? In fact, 4 or 5 days may be the longest stay you see in acute care. And if you're unaware, the statistics in acute care are unbelievable, all right? It's as bad or even worse, I might say, than long-term care, what you would see in long-term memory care. And I went in just digging, doing some research. I'm gonna help her out here and see what I can come up with, but there's all types of different measures. There's alarms on beds. There's straps for extreme cases. There's the pressure sensors in the beds I was just talking about. When a patient sits up or moves, the alarm goes off. You could have people that are on standby to assist someone as they need to go to the restroom and this and that. All kind of measures in place, but it's still a big problem. In fact, each year, somewhere between 700,000 and 1 million people in the United States fall in the hospital. And research shows that close to 1/3 of falls can be prevented. Now, here's the other challenge. Medicare, Medicaid, once you're in the hospital for one reason and you fall inside the hospital, insurance is not going to cover you, Medicare, Medicaid. They're not going to cover that fall or reimburse that hospital for whatever treatment needed for that fall. So this becomes a money issue as well. A fall may result, we all know this, in fractures and cuts, bleeding, internal bleeding, and increased care in terms of stay. You may have to stay longer depending on how bad you're hurt. As of 2008, the Centers for Medicare and Medicaid, they do not reimburse hospitals for certain types of traumatic injuries that occur while a patient is in a hospital. So in terms of healthcare workers and especially directors, these guys are desperate to find measures to help prevent falls. So we're going to go and look at some different ideas, maybe some different methods. Here's something that's interesting on the practitioner side and the patient side as well. What they share in common is about education. It's about making sure the patient understands their risks. There were 43 studies that satisfied the systemic review criteria, and 23 included in meta-analysis. So this is a review of a bunch of tests, of a bunch of reviews and a bunch of studies, okay? And what they found was the only intervention that yielded a significant result in the analysis was education, in terms of a reduction in falls. Now for us, we're not in acute care, obviously, but that's something that is encompassed in our prevention and our goal to stay strong, mobile, and independent for the rest of our lives, all right? So with that, let's have you stand. Let's go behind our chairs. We're gonna rock and roll this morning.